What are some simple tips that you would like to give out? Because, my viewers, the maximum viewership that I have is they're all from sports fraternity.
Okay.
So what are those single or, some tips that you would like to give, especially to people who are more into bodybuilding, weightlifting, gym goers? So what are those tips that you would like to give out?
I think, see, whatever the first thing they're doing is they're exercising, and which is what we tell every patient of ours also to go through with that.
Yeah.
But definitely the supplements are something which we always tell them to just to be a little more careful on those parts. Because recently we did see a lot of patients' kidney functions rising in those. So we always say you go with the proper medicated proteins, or if you can do it from your diet, it is still the best way. But as long as you know the source is good, then it's still okay to go with these proteins. And definitely warm up before you do any weights, because a lot of times they end up injuring if trying to do the heavy weights, and the muscles are not in order, so that's which leads to the strain, and then it pushes you back 3 months. So these are, I think, few of the tips. Most of the tips we take from them on how to go.
So two questions out here. One is, when you're saying supplements, what exactly do you mean? Do you mean the normal protein, which has now, so the supplements have become in two different categories. One is normal supplement and one are advanced supplements. So normal supplements these days for a lot of gym goers are like the protein, BCAA, creatine, pre-workout, post-workout. So this has now become a norm. Maybe a lot of business entrepreneurs are promoting it that way.
Yes.
That this becomes a normal supplement, whereas advanced supplements are those,
the steroids,
the steroids and all. So the supplement that you're talking about is what? Is a combination of both?
Yes, normally we mostly prefer only with protein supplements to go with, basically. A lot of times these heavy chemical workouts can at least increase your metabolism. It does give you energy. But long term, they may have a deleterious impact also. Like recently, a lot of young people we saw who had high creatinine, who had liver functions which got deranged. So they didn't know exactly they were taking something from the supplement parts only. But once they stopped it, the things started getting reversed.
Because of creatine?
Creatine is one thing, yeah. Because two people we saw had a similar intake of that. So somewhere it may or may not suit your body throughout. So I think that is some assessment which even the gym people should get it done, at least get their basic test done of the patient before they tend to prescribe, and just follow them up with these tests also.
Okay, so what sort of test do you recommend, one should do?
Mostly we go with your kidney functions and the liver functions only whenever patients are on these, because these are the two organs which metabolize everything. And the filtration is also through your kidneys only.
Okay.
If anything which is going in excess of them to handle the load, they'll start throwing some reaction through it.
Okay.
So at least baseline we should try to do, and at least after 4 weeks of taking those supplements, we can get that done.
And regularly, how frequently they should get these tests done?
I think it depends on how frequent, how much are you taking the supplements. If it suits your body, then obviously you can prolong it to 3 months duration, 4 months duration. So that way it will be more comfortable on that part as well.
Okay, sure. And the other question that I wanted to check, let's say people in the gym, they're doing heavy weights, and continuously they're doing heavy weights. I understand they're taking a lot of different supplements, and I'm not talking about advanced supplements. I'm just talking,
basic one,
protein and maybe creatine and BCAAs, and they're more on diet. They're eating good food to ensure that they have enough protein in their body, but at the same time, they're working on their muscles. But at the same time, when they're lifting heavy, it is impacting their bones, right? Yeah. So, do you think that lifting heavy continuously is going to impact once they leave gym and once they're, let's say, above 40 and 45?
I think the fitness level will vary definitely from person to person. So if a person who has been doing it constantly for quite a while, the bones also definitely get stronger with that. And that's why we tell them at least calcium, vitamin D and some glucosamine supplements after the age of 40 we prefer adding for a lot of people. Because it at least keeps the joints healthy. But see, if you try to understand the bone, the joint, basically it is supported a lot by your ligaments and the muscles and the tendons. So if you're strengthening them, the support automatically gets better for the joint as well. But then we definitely ask them after a certain age to avoid the strenuous ones or something which will put more posture on more impact on the joints. The deadlifts, normally we have seen a lot of people spraining the backs after it. If anybody has a knee problem, we definitely ask them not to do anything, like deadlift or run even on the treadmill for that matter. Because sometimes a lot of friction comes in the knees and that causes a little impact on those. So as long as the fitness is there, you best know your body the best. So you're still okay to go with a lot of other weights also. If you see Milind Soman, I think is still quite good at the 56, 60, still quite worked up.
Yeah, but he's an exceptional person. But I'm talking about a lot of generic people around me, and I see a lot of people doing heavy weights. So so what my question is: do the bones they get aged?
Yeah, bones definitely get aged, and the joints also start aging.
Yeah.
So all that definitely goes with. But as I said, if you're precautious on them from the early ages, so you may not have a problem at the later age also. Definitely once you start experiencing something, then you should not overexert it. Because that is where it will cause more wear and tear and you may not be able to carry on those activities then further.
Sure. What sort of natural food intake one can have to have a better, bones and safer bones, apart from having calciums and whatever.
So foods basically we like natural sources will be your dairy products. At least the milk should be always a part of the diet. Then green leafy vegetables should be there. Fruits always work as a good antioxidant for our system. A lot of other foods which have a little bit like glucosamine in it are your turmerics, there's the cinnamons, then there's anjeev, they say it's quite good for the joints. So these are few things which we can include. That's why they say the Mediterranean diet is a little healthy because it has more of the veggies and the fruits and less of the other carbs through. And natural aloe vera is again which has come up recently. So it has a very high content of the glucosamines as well in the body. So these are the few of the foods, and the proteins if you can take from the diet, be it vegetarian also, a good ball of dal, this thing kale chane, white choles, paneer and the green beans, soya salad, sprouts, all these are quite good to go with. So they are natural sources of proteins which you can incorporate. And non-vegetarian has still a lot of options. Vegetarians always have a little limited.
Tell us about some modern medical tools which are now available, which help all the doctors, which was not there a decade ago.
See, some AI is definitely coming through, but it's still in a very preliminary stage to diagnose it in other way. It's a little better than just typing it on Google, that at least it will narrow down your diagnosis, but then it will still leave you at 3 or 4 differential diagnoses. But now AI is being used a lot in the surgical fields as well. And robotic trainings has come through, which was not there before. So the robotic surgeries are far more precise, less blood loss, and your hospital stay also gets shortened with them. They're still a little more expensive than the conventional ones, but definitely if your stay and other things are shortening, you definitely have a little higher chances of good recovery here.
Okay.
So robotic definitely has taken over quite a lot. AI is still a little bit under supervision, that how it will help the physicians and how it is helping the surgeons. So it is still going on a trial with that.
How do you navigate the challenges with the difficult patients when they come?
I think patients, I don't call it difficult. See, they come to us because they are in some sort of trouble. They do definitely have some apprehensions going on. Some have a little more apprehensions than the other people. Mostly patients reach to us when the diagnosis is not there. So I think always whatever incorporated in practice to listen to the patient at least. Because if majorly patient feels there is a problem and nobody wants to listen to them. When the doctor's cabins are a little busy, they will just mostly if they're giving just 5 minutes, there's not much completed. So I think it's always good to counsel them, listen to them, at least listen to their thoughts, and at least you express your opinion properly and give them the honest answers with that. Some patients are satisfied, some definitely go to other doctor the same evening, they'll probably look for other opinion also. So there are all types of patients, I think, but anybody who's troubled, you just have to listen to them patiently. Hear them out, and a lot of them feel better that at least whatever the doubts I had, I don't have to go home and still have that. I didn't ask my doctor that. So that definitely helps a little in our practice.
So you hear them out.
Yeah. So
okay, you give them that time.
A lot of times I do get blamed that, this he's taking so long, he's doing surgery inside or what. Some patients do take 25-30 minutes also, but it's always better to at least give them time and sort out the condition.
Sure. Tell us, is there a difference between, or what is the difference between arthritis and spondylitis?
See, spondylitis is like another general term again, basically. What we call as a cervical or we call as a lumbar. So spondylitis again is two. One is the ankylosing spondylitis which we talked about. Another is the degenerative one, where the neck, the bones will start crumbling down and coming together. There may be some extra bone growth also which will start impinging on the nerves. And that is a part and parcel of our natural process because over time we all degenerate through and through. So this is where your other part comes in, that if your musculatures and other things are stronger from before, your muscles are able to handle the load, so they'll be able to take part of care of the bone also. But spondylitis basically refers to those extra bony growths, loss of space in between the neck and the spine, and that causes a little restriction in your posture also and a restriction in the activities also. So this is called as a degenerative one, and the inflammatory one is called as the ankylosing spondylitis one. So that ankylosing, what we are talking in the knees, it causes the same thing in the spine also, but at a very early age of 25-30.
Okay.
We have patients who are bent completely this way at the age of 30-35 also.
You've seen that?
Yeah. So they had a very early start with ankylosing spondylitis, and before these newer drugs were available, it eventually caused them to.
But they refer to a rheumatologist only.
Yeah. They also come through us basically.
Okay. So now, I'm finally getting the hang of what exactly is the difference between the orthopedic surgeon or rheumatologist, which is good. So tell us about yourself. How do you ensure that you keep yourself fit and away from all these diseases?
See, I think I definitely everybody was a little lazy throughout the life. So that was my case also. But then as I started hitting 38, 39, I started feeling a lot of problems. Little breathlessness used to come through while doing some activities. So now I made it sure I made a home gym, and at least in the morning, 40-45 minutes, I give it time to that. So I'm going to drop my daughter to school, and after that, before I come to the hospital, at least 30-40 minutes I give it in. And step counts, I try to keep at least till 7,000-8,000 whenever it's possible.
Okay.
So at least I'm not able to do 7 days, but 5 days a week I make sure I do that. Diet wise, I started cutting down on carbs a lot. Because there are days then you're not able to exercise. So at least if your diet is not very heavy that day, you don't feel bloated. And cutting down on carbs helped a lot to keep me active also, and little less of the bloating as well. So diet is something which we should all incorporate, and we can incorporate in our routine.
Correct.
Even if there are days because of that we're not able to exercise, at least from diet point we can go. Because eventually see weight loss, weight in check does happen from diet only. We are not able to exercise that much as people like proper bodybuilders do, but in a daily routine, 30 minutes, you may not burn more than 100, 150, 200 calories. So if you keep a daily intake of calories to 1400, you're quite good to go.
But you think with normal exercising, keeping a check on your diet, you can stay away from all these diseases?
See, at least you can do your part,
Yeah.
So there is something which are in your control, some things are beyond your control also.
So you're saying that even after doing all this, you may develop this rheumatology?
Yeah,
and
you can still
develop that.
We do have patients who are like athletes, marathon runners, but they still develop this whole thing,
Does it come hereditary also, or
yeah, if your family member has it, so there's definitely 4 to 5% risk of you getting it.
4 to 5%?
Yeah, normal population risk is 1%, but it goes up almost 4 to 5% times. And siblings are something which get affected a little more. And some disease definitely very high, they pass on, especially the uric acid problems, the psoriasis, this ankylosing spondylitis. They are the ones which pass on genetically quite high.
Okay. So, Dr. Naval, we've understood the science behind this. We've also understood, the key differences and what are the different diseases in it. But what is the main treatment that you have for this?
The treatment, as we discussed earlier, there's a lot of myths that, there are only painkillers and steroids for this disease, but that's normally not the case here. So we have two new categories of drugs. One is still quite old. It started in 1980s and 90s. That is called the disease modifying agents. So we have few of the drugs like methotrexate, sulfasalazine, leflunomide, hydroxychloroquine. And now they are the new conventional medicines called as the biologicals. So biologicals are still one of the best treatments available. Only thing, the cost is still an issue in our country because a lot of government schemes don't have it or have it for very selective people. Insurance does not cover it for a lot of people. But biologicals are the newer drugs basically which are made from the humans only, and they tend to attack the immune system quite precisely. Like if you have heard the immunotherapy which has come out in cancers, to similar lines, these biological medicines are also there.
So when you say biological medicine, what exactly do you mean by that?
It's basically like made from the humans. They isolate the plasmas. They prepare them to attack those cells basically which are causing the havoc in our body.
Okay.
So these old drugs also work on that, but their blockage may be 60%. The biologicals will block those harmful cells to 90%.
Okay.
So some people, when before the biologicals, there was no options, but people used to go to steroids and other things when the treatment didn't work that time. But now with at least these newer medicines available, we have an option for the patients that yes, if your conventional medicines are stopped to working, you can opt for these drugs also. So there are some oral drugs also which are available, and now they have the injectable ones also. So always the myth comes that yes, they are going to be very harmful to our body or other things. But so far we have been using for last 12, 13 years, they're still quite safe to go with. Only we do some certain tests, rule out tuberculosis, because in India you always have a higher exposure to tuberculosis. So that is one test we just do to rule it out, and some viral markers. So if all those are okay, this is a good option to take through rather than being in pain throughout. Today I had a guy who was on painkillers for last 3 years for this ankylosing spondylitis at 23 years. But since he started his biologicals, he's been completely free of those painkillers. He's completely leading a normal life now.
And how frequently do you do that? I mean, the treatment?
See, it depends on again patient to patients. Like a lot of patients, we normally tend to space out our biologicals also for the patients, for the risk of cost also, and to prevent any infections on further taking. Outside countries, they use it very frequently as per the schedule. They don't space it out much. A lot of our patients do good with a single injection for 2-3 months also, 4 months also.
Okay.
So if you're doing good with that, with minimum medicines, it's never a bad thing to have. So the side effects are something which we have seen through hardly 4 or 5 patients of mine of 1,000 may have developed tuberculosis. But that also happened a little later on after stopping the medicines.
Sure. And the treatment, does it also include the one which is there in physiotherapy, wherein there are some exercises that have been prescribed, and I see in a lot of clinics they've created small gyms also to ensure that they're working on that part. So do you have something of that sort? Or
yes, see, we do have some sessions with the corporates also at times, and we always tell them that once in a week you should have your exercise type of schedule for your colleagues, at least morning. Or so a lot of offices have started doing also that early morning they keep 10 to 15 minutes of just mobilizing the joints and other things. So that concept is quite good if you can have a gym inside. I did my training in Singapore, and there in the hospital we had the gym. So a few of the employees used to do it during the daytime or before going home as well. So that concept definitely eliminates a lot of other factors of distance, the cost, and other things. So people will be more inclined to do it also that time.
No, but my question is that is that a part of your treatment, or no? It's just the medication.
Exercise is still a part of treatment. It works as good like painkillers. So a lot of times we always say cardio should be your main focus, be it like brisk walk, cycling, or swimming. Any of these 3 will definitely help mobilize your joints because it will increase the blood flow. And once you start exercising, this increased blood flow helps to stop the pain chemicals also. That's why most of the symptoms, if you see, are in the night times and early mornings. But once you are up and about in the day, the symptoms go down. So exercise plays a very important role in our diseases.
But you missed out on running. You don't recommend running?
Running is also fine.
Is also fine.
Yeah. But a lot of times, at least we push them on brisk walk. But then if they're comfortable, they start increasing it by themselves. Physiotherapy helps a lot in other conditions, like which we're talking about: tennis elbow, golfer's elbow, the cervicals, the low back pain. So there the role of physio and yoga is very helpful. So these are like conditions of more like a sprain which needs strengthening. So there we prefer patients that you go with physio also. If it's yoga suits you, go with yoga. Okay,
so basically what you're saying is the primary medication or treatment is just a medication in rheumatology.
Yes.
Not precisely or 100% physiotherapy.
Not 100% physio. Because unless you stop the inflammation within the blood, the externally factors may not play too much role in those. Physios definitely help mobilize the joints, but then rheumatology is a disease of the blood. All these rheumatoid factor, anti-CCP, other things we check are all from the blood only. So we have to stop the inflammation from the blood itself. So once you stop that, then the physios and other roles will also be more effective in those conditions.
Got it. Any final tip to our viewers that you would like to give away, Dr. Naval?
So I'll just tell, majorly try to keep your lifestyle as healthy as we can to avoid a lot of long working hours. Definitely the working hours are equally high for every profession now. So make sure you mobilize your postures, and other things should be something which you work on very early, and avoid a lot of processed foods, preservative foods. So these are the few things, at least in your daily life, we can now incorporate. For arthritis point, if you do find patients, somebody who's suffering from it around you also, just make sure they go to the right person, because that is the time which we can control the disease and give them a better quality of life. So that will.
Okay, so that's the end of our episode today. A huge thanks to you, Dr. Naval, for sharing your insights and expertise with us. And thanks to our viewers as well. And if you have enjoyed this show, please like, watch, subscribe, and share it with your friends. Thank you so much.
Thank you, Mayank. I'm sorry for keeping you waiting.
No problem. Thank you so much.
So thanks, Mayank. It was my first interaction with him on his NH talk show. And it's a very important initiative what he's doing, because the goal right now in this specialties, in all specialties, to spread awareness, to help patients reach the places early, to make sure their diagnosis is right and they can avoid the unnecessary medicines. And this is one of the only ways, I think, which we can reach out to the mass population. It's quite appreciable what he is doing. He has been after me to get this talk done, because I only had kept delaying him. But thanks to his persistence that we are able to complete the talk show today, and I hope people benefit from it. Thank you.